Thank you, Chairman, for the very kind introductions. And I would like to also thank the committee for inviting me for this very prestigious meeting. My name is Pinson, and today I would like to discuss with all of the audience about long COVID syndromes that focus on the neurological manifestations. I come from Yogyakarta, Indonesia. And we have this clinical question today. We have many clinical questions related to the COVID-19 about the severity, about the onset, and about the durations. And today we would like to talk more about the durations. So we will have question about what is long COVID, how common is long COVID, who have a greater risk of having long COVID, and also what are the common neurological manifestation of long COVID, how it happens, and also what can be done, what can we manage our patients with neurological manifestation of long COVID. So what is long COVID? The presentation and management of COVID-19 can be broken down into the three main phases. The first is when the patient have acute COVID-19. Its signs and the symptoms of COVID-19 up to 4 weeks. And then we have ongoing symptomatic COVID-19. It means that the sign and the symptom of COVID-19 still persist from 4 to 12 weeks. And then we have post-COVID-19 syndromes. It means that the sign and the symptoms that develop during or after an infection consistent with COVID-19 continue for more than 12 weeks and are not explained by an alternative diagnosis. And I think this is a very important point. So we have to exclude any other possible causes that can cause the sign and symptoms that are related or mimic the COVID-19 manifestations. So what is long COVID? So long COVID has been commonly used to describe any sign and symptoms that continue or develops after acute COVID-19. It includes both ongoing symptomatic COVID-19 from 4 to 12 weeks and also post-COVID-19 syndromes more than 12 weeks. So any signs and symptoms that develops during or following an infection consistent with COVID-19 will continue for more than 12 weeks and are not explained by an alternative diagnosis. So there are two important points here. First is the time. It must be more than 12 weeks after the infections. And also we have to exclude any other possible causes. So we will have the transition after the diagnosis and the symptoms of acute, and then after 4 weeks or 5 weeks, so we have the acute post-COVID-19 symptoms or ongoing symptoms. And after 12 weeks, we have long post-COVID symptoms and also persistent post-COVID symptoms. And it happens still persists after 24 weeks. There are so many factors related with the persistence of the COVID sign and symptoms. The intrinsic factors is elderly, female gender, patient with pre-existing comorbidities, and also epigenetic contributions. There are any other extrinsic factor, the biological, the SARS-CoV-2 infection itself, the viral load, and also some psychological and social factor is very important also. So who gets long COVID? The prevalence then in the incidence of long COVID is between 2.5% to 15% in patients with COVID-19 infection. So 2.5 to 15% of the people still symptomatic after 12 weeks. Factors that appear to be associated with a greater risk of suffering from long COVID appear to be elderly, patient with obesity, female, patient with any pre-comorbid conditions like asthma, and patients that have multiple symptoms and presentations. So this is the summary of the risk factor for long COVID. When the patient have abnormal lab results during the COVID-19, for example, lymphopenia, thrombocytopenia, high D-dimer level, LDH and troponin, and also high CRP, ferritin, and interleukin-6, and also patients that have coagulation problems. And also patients that have underlying comorbidities such as diabetes, hypertension, obesity, patients with a cardiovascular disease, smoking, alcoholism, and patients that have a chronic kidney disease. And also elderly. And then the disease severity, it means that patients that have been admitted to ICU, patient that length of stay in ICU, and also when the patient need assisted ventilations. And the other factors is the patient that have more than 5 symptoms during the first week of infections, middle-aged female, and also patient with spreaded infections. The manifestations of long COVID syndrome can be various. It includes multiple organ and systems, and many studies mention that ACE2 play a very important role in these manifestations. When we talk about the brain, so the manifestation of long COVID syndromes commonly is brain fog, memory and concentration problem, delirium, fatigue, sleep disturbance, and also post-traumatic stress disorder. So this is the long-term effect of COVID-19. So this is the common risk factor that associated with the COVID-19, especially the laboratory abnormality. And if you can see that the most common manifestations of the long COVID-19 syndrome is fatigue. So more than half of patients will have a fatigue. And if we talk about the neurological manifestation here, we can see headache is also the most common persist symptoms after the 12 weeks of the COVID-19, and also sleep disorder and memory problem. So the patients that have COVID-19 can be various from asymptomatic, mild, moderate, severe, or critical. And then we will have control infections. And in some patients, the severity related with the cytokine storm. There will be clinically recovery of acute illness, but many studies now have mentioned that the disease will continue. It not stop just in the acute phase, but the disease will continue. It could be from the direct viral infection. It will be immune and inflammatory perturbations, hidden viral reservoir, and also abnormal metabolisms, and also dysfunction of mitochondria, imbalance of the renin-angiotensin system, and the altered microbiome. And all of these mechanisms will relate with the happen of the post-acute sequel of COVID-19 or long COVID-19. And the risk factors will be obesity, patient with pre-existing comorbidities like diabetes, hypertension, patient with a cardiovascular disease, patient with pulmonary problem, and patient with chronic kidney disease. When we talk about the long COVID syndromes, one of the common manifestation is in the neurological manifestations. When we talk about neurological impairment after COVID, then we will have neurological deficit, including stroke, seizure, and Guillain-Barré syndromes, have been reported in more than 1/3 of COVID-19 patients. It's a very high, especially related with the coagulation factor, especially in the acute and also post-acute. And then the continued decremental effect of COVID-19 in the central and autonomic nervous system could be result of the direct viral encephalitis, the systemic inflammations, Peripheral organ dysfunction, it means that when the COVID-19 affect the liver, kidney, and lung, it will also affect the metabolism and also brain, and or cerebrovascular changes. Systemic inflammations could promote cognitive decline and also neurodegenerative disease. And it is very common, we see from the previous study and from the previous epidemic that neuropsychiatric sequels can be happens until months post recovery from the past epidemics when SARS or MERS or influenza. It means that this phenomenon is a very common after epidemic. So to answer all the clinical questions, we make three study. First, we make a systematic review and meta-analysis about neurological manifestation in long COVID syndromes. The manuscript has been submitted and we are waiting for the publications. And also we perform online survey to the post-COVID-19 survivors and also perform online survey to the neurologists in the Central Java or Yogyakarta province, Indonesia about a long COVID syndrome. So this is the first approach to answer the clinical questions. This is our systematic review and meta-analysis. We perform systematic review and meta-analysis about the prevalence of neurological manifestation in post-COVID syndrome. This is the PRISMA algorithms, and then we continue to look more and more about the study. There will be 36 studies that we observe and also price about the prevalence of neurological manifestations. So this is the characteristic table of the study. And if we talk about the most common neurological manifestations, it is a fatigue. It happens, the prevalence is more than 50%, and also cognitive problems. It happens about 1/3 of the patients, 35%, and also paresthesia, more than 30%. And then we have headaches, more than 20%. So this is the most common manifestations of long COVID syndrome in the neurological field. Fatigue, this is the combined result of the study. The prevalence could be very various from study to one study from to other study. It really related with the definitions, with the methods, with the tools that measure the prevalence of fatigue. But our pool analysis show that fatigue can happen more than 50% of patients of long COVID. And also cognitive problems, it is about 30% of the patients report the cognitive problems, the brain fog, memory impairment, and also concentration difficulties. Sleep problem is also very common. It could be related with the PTSD, depression, and also anxiety after the COVID-19. It happens about 30% of our patients. And also headache. Headache happens in about 20% of the patients. And then, so we have 4 common symptoms of neurological problem after the long COVID: fatigue, cognitive problems, sleep disorder, and also headaches. And then we make an online survey to the COVID-19 survivors. We take this data from the cohort from our hospital, either in patients that have been hospitalized and also patients that not been hospitalized but hospital monitor self-isolation program. There were 136 patients with a COVID-19 confirms with PCR. And then after that, we make an online survey. Then 64 patients, the survivor of COVID-19, answer that they have at least one neurological problem after the COVID-19 infections. And 12% of them must consult to the doctor for their symptoms. And this is the problem of neurological manifestations, and it is also consistent with the other studies. Fatigue is the most common problem in long COVIDs, and also muscle pain, forgetfulness, concentration problems, sleep disorder, and headache. And then we make an online survey to the neurologists. There will be 36 responders. 63 of the responder is male, and more than 50% of the neurologists practicing more than 10 years. And 44% answer that 10% of their patients have a long COVID. And it is also consistent that the neurologists also mentioned that fatigue is the most common problem reported to them. So the patients come to the neurologist because of the fatigue, because of the headache, because of the sleep problem, muscle pain, and also concentration problem. So I think this is the most common manifestation that reported in long COVID. The other question is, how can it happen? So after the acute COVID-19, the potential immunopathological mechanisms of long COVID should be hidden viral reservoir. It means that the viral continue. And also immune exhaustion, viral induced autoimmunity, abnormal immunometabolisms, altered microbiomes, and also imbalance in the RAS systems. All of these mechanisms will be related with all the manifestations in many organs related with the post-acute COVID-19. When we talk about the nervous system, central nervous system, it will cause headache, anxiety, brain fog, sleep disorder, fatigue, and also myalgia. So long COVID and the central nervous system, the long-term immune response will activate the glial cells with chronically damaged neurons. And also we have the hyperinflammation conditions and also hypercoagulability states that lead to increased risk of thrombotic events. That's why we see many patients with stroke, cryptogenic strokes after COVID-19 infections. And also the blood-brain barrier damage and dysregulations that result in pathological permeability that allowing blood-derived substance and leukocytes to infiltrate the brain parenchyma. When the chronic inflammation happen, it could cause also the autonomic dysfunction and also memory impairment. So how COVID-19 affect the brains? We have the COV2 virus that invades the endothelial cells via ACE2 receptors. And then we have cytokine elevation, cytokine storm, and also microglial activations that related also with coagulations, lead to the thrombotic events because of the high D-dimer, the increased von Willebrand factors, also the fibrin abnormality, and also the platelet activations. And then there will be altered neurotransmitter and excitotoxicity, and all of these factors will cause the neurocytic symptoms. It related when where is the area that affected. So neuropsychiatric symptoms differs depending on the Brodmann area that involved. It can cause cognitive problem, sleep problem, headache, and also post-traumatic stress disorder and anxiety and depressions. Long COVID and fatigue. Fatigue is the most common symptoms reported. Chronic inflammation in the brain as well as the neuromuscular junction. And many studies show that in skeletal muscle, the sarcolemma damage and fiber atrophy have been reported, and also this damage may play a role in the fatigue. And this is consistent. We see many studies, many studies that, especially in SARS and MERS, that 50% develops myalgic encephalomyelitis or chronic fatigue syndrome after the SARS and MERS infection. So the presence of fatigue is a very common after acute illness, especially infection with virus. And also 11% of patients develop a chronic fatigue syndrome after Epstein-Barr virus and Ross River virus infections. So this is a very common manifestation after having acute viral infection, especially in SARS and MERS. Exposure to viral or any infections will cause the oxidative stress. The presence of the oxidative stress can cause the membranopathy or channelopathy and also dysfunction of mitochondria. It will lead to the impairments of the elemental compositions, the violations of the intracellular energy process, and also the impairments of neuromediator synthesis, the imbalance of the signal conversion system, and the alterations of the intracellular interactions. All of these mechanisms will lead to the presence of the hormonal imbalance in the pituitary, adrenal glands, and also the hypothalamus, the immune system alterations, the decrease of vasopressions and renin activity, and also the cytokine system imbalance. All of these things will lead to the presence of the chronic fatigue syndrome. So this is the mechanisms that related with the chronic fatigue syndrome after the COVID-19 infections. And it is a very common manifestation with after epidemic, especially we have the data about this condition after SARS and MERS. So how we can approach these patients? I think the next speaker also will talk more about that. It is difficult to formulate a management strategy for post-viral fatigue and other neurological manifestation because we have very limited data, evidence-based recommendations that based on the well-designed randomized controlled trials. After now, there are limited evidence-based recommendations. There are ongoing studies that use carnitine, that use high-dose vitamin C, high-dose vitamin D, and also cognitive behavior therapy, and all combined approach to treat long COVID. But the data is still limited, and we still have ongoing publications. So it is reasonable to assume that the standard management strategies employed for non-COVID condition could be applied to manage the long COVID. For example, when we manage the fatigue, we manage the chronic fatigue syndrome for any other possible causes, not for COVID. I think we can use it also for long COVID syndrome. So the standard approach to management should be adopt the main concept of bio, physical, and social philosophy. So this is the summary of my discussion. Long COVID is common. The most common neurological manifestations are fatigue, headache, memory problem, and also sleep disorder. And currently, there are so many questions about the long COVID and also how the impact of the new variants. We still have limited data, and also how will it affect the incidence and the severity of long COVID also. We still have many questions about that, and we need more data. And so it is important that we wait for the research that continue to explore the post-COVID-19 syndrome. So I hope it will give us the greater understanding of the pathogenesis, about the risk factor, so the symptoms, and how we treat the long COVID syndrome in the future. Thank you very much for your very kind attention.